There are two kinds of hypertension, essential and secondary. Definition of the essential hypertension is office value of the systolic blood pressure equal or more than 140 mm mercury and or diastolic blood pressure more than or equal to 19 mm mercury in the absence of the secondary causes or other illness. Secondary hypertension is office value of the systolic blood pressure equal or more than 140 and or diastolic blood pressure equal or more than 90 in the presence of the other disease like kidney disease, adrenal disease, thyroid problem, and sleep apnea. Hypertension classification according to European guideline. First, optimal when the systolic blood pressure less than 120 and diastolic blood pressure less than 80 mm mercury. Normal, the systolic blood pressure between 120 to 129 and or diastolic blood pressure between 80 to 84. High normal, the systolic blood pressure between 130 to 139 and or diastolic blood pressure between 85 to 89. Grade 1 hypertension, the systolic blood pressure between 140 to 159 and or diastolic blood pressure between 90 to 99. Grade 2 hypertension, the systolic blood pressure between 160 to 179 and or diastolic blood pressure between 100 to 109. Grade 3 hypertension, the systolic blood pressure equal or more than 180 and or diastolic blood pressure equal or more than 110. And the last one is isolated systolic hypertension, the systolic blood pressure equal or more than 140 and diastolic less than 90. Office blood pressure measurement. Patients should be seated comfortably in the quiet environment for 5 minutes before the beginning blood pressure measurement. Then 3 blood pressure measurements should be recorded 1 or 2 minutes apart. An additional measurement only if the first reading differ by more than 10 mm mercury. Blood pressure recorded as the average of the last 2 blood pressure readings. Use a standard bladder cuff 12 to 30 cm wide and 35 cm long for most patients. The cuff should be positioned at the level of the heart and the measure blood pressure in the both arms at the first visit to detect the possible between the arm difference. What is white coat hypertension? It occurs when the blood pressure reading at your doctor's office are higher than they are in the other settings, such as your home. Mass hypertension is defined as a normal blood pressure in the clinic or office, but an elevated blood pressure out of the clinic. Hypertension risk factors. Sex, male more than female. Higher age, higher risk. Smoking. Diabetes mellitus. Uric acids, obesity, early onset menopause, sedentary lifestyle, and total cholesterol. Lifestyle intervention for patients with hypertension or high normal blood pressure. Salt restriction to lower than 5 grams per day is recommended. It is recommended to restrict alcohol consumption to less than 14 units per week for men, less than 8 units per week for female. But it is recommended to avoid drinking. Increase consumption of the vegetables, fresh fruit, fish, nuts, and olive oil, and also low consumption of the red meat. Regular aerobic exercise, at least 30 minutes of the moderate dynamic exercise on 5 to 7 days per week is recommended. Smoking cessation, supportive care, and referral to a smoking cessation program are recommended. Initiation of the hypertension treatment according to office blood pressure. Lifestyle change recommended for all grades of the hypertension. Prompt initiation of the blood pressure lowering drug treatment is recommended in patients with the grade 2 or 3 hypertension at any level of the cardiovascular risk, in patients with grade 1 hypertension at low moderate risk and without evidence of the hypertension-mediated organ damage. Blood pressure lowering drug treatment is recommended if the patient remains hypertensive after a period of lifestyle intervention. In the patient with the grade 1 hypertension and at the high risk or with evidence of the hypertension-mediated organ damage, prompt initial of the drug treatment is recommended with the lifestyle intervention. Core drug treatment strategy for uncomplicated hypertension. First of all, memorize these letters: A, B, C, D. A is ACE inhibitors and angiotensin II receptor blockers. B is beta blockers, C is calcium channel blocker, and D is diuretics. First line is dual therapy. A plus C or A plus D. In the beginning, we use ACE inhibitors or ARB plus CCB. The second choice is ACE inhibitors plus diuretics in one pill. Consider monotherapy in the low risk grade 1 hypertension, and old people we use the ACE inhibitors or sartans. Second step, when A plus C or A plus D not effective, we make triple combination A plus C plus D in one pill. If the second stage didn't work, we call it resistant hypertension, and we prescribe combination of A plus C plus D plus we add another drug like spironolactone or beta blocker or other diuretics. That's it. So guys, this is the right treatment strategy for uncomplicated hypertension. For complicated situations like hypertension and coronary artery disease or hypertension and chronic kidney disease, I will explain a strategy in another video. If you enjoyed this video, please support us by hitting the subscribe button and commenting on comment section.